Hello, Professor. Um, this is MN664 Journal 2. I realized that I actually did my Journal 2 last week, so I guess I'll do Journal 1 this week. Or the topics for Journal 1, where it says describe an experience or my past experience with mental health or someone with mental illness. Something that is more recent with mental illness is, well, actually, my mother struggled with some depression and suicidal ideation this last year. She had some medical circumstances that really brought her down, and she was in constant, I guess, a little bit of pain, but also nausea from COVID, which was wild. She never thought she was going to get over it, and so she became suicidal. And I didn't handle it the greatest. I was triggered, I was angry, and I felt like she was being selfish is what my feelings were. But I then realized, I was like, man, this is not the way that I'll be talking to patients. Anyway, yeah, taking me back. Okay. What are the reasons you've chosen to work with this population? I have always had a fascination with like my psychology classes and even marketing. I feel like understanding the reasons why people do things and some malfunctions is really interesting. Another reason, personally, I've struggled a little bit with some mental illness, and it's rampant. I think that social media and the access to electronics has affected and altered the way our society functions, and I think that mental health is just getting worse and worse on a broad picture. Any concerns I have regarding this clinical course? I am actually really excited about this clinical course. I had my first couple clinicals, and it's at a hospital that has, it's like an old hospital that they built a new building for the main hospital. So this old hospital has like a bunch of outpatient stuff, but then one floor is dedicated to mental health, and one side is inpatient and one side is outpatient. And so I'm seeing two providers on the outpatient side, but one of them, because of needs on the inpatient, she covers when they have too many patients in the inpatient, she'll follow them and she'll be the provider, the primary, which I think is super interesting and has already been a really interesting experience seeing both and having just kind of being thrown in. I haven't really had the experience of like having to really communicate and like chart and those kind of things yet, which I understand. We're just, I'm still getting just a hold of the core elms and the charting I have to do there and practicing. But they actually already invited me to come back for my fourth semester, which I'm considering, and I think it would be really beneficial to be able to kind of grow not over 10 weeks but over 20 weeks with these providers, and they can teach and then expect that I understand it and learn. And so one of them had mentioned that I would be sitting like in her chair if I came back for the fourth semester, and she'd be the one observing, which terrifies me, but is also, I think, probably one of the best experiences that I could get. So anyway, I'll check that off as my academic goals for the next couple of clinical courses. Thank you.